Oh, you got a charger?
Sheena. Hi.
How y'all doing?
Good.
Okay, yeah, my brother is
Get started soon, but I just want to invite you to our Kappa Alpha bar that's in the back. We also have coffee, water, and then we have resources along the wall. So we'll be starting shortly. We'll see water, soda, caramel apple, coffee,
ready?
Yes.
All right. All right. So we're going to start our program. We're going to start with the greeting from Dr. Zanita Driver, followed by the introduction of community service by Sister Michelle Hill. Good evening, everyone. Good evening. It is my pleasure to welcome you all to our Menopause workshop, where we are going to raise awareness around such a relevant topic. We are here today to discuss the topic that affects so many women. If we're honest, menopause is one of those things we don't like to talk about. But truth be told, many, if not all of us, go through it. So today we have a panel of young ladies and a gentleman who is going to raise awareness, educate us, teach us about all things concerning menopause, all things concerning our emotions. Francine, they would say emotions. Right? All things concerning our emotions and all of the things that we go through as women when we embrace this idea or this concept of menopause. So we hope that you are comfortable, as our president has already shared with you. We have some treats in the back. We want you to be comfortable. We want you to get to know the person beside you, share, ask questions, be open, because the information we learn today won't only help us, but it'll also help another sister as well. And so we welcome you all, and we thank you all for coming. We also are partnering with the city of Chester. So after we will now have a welcome from Rosetta Carter, who is the Director of Community Health, Education, and Services. We also are excited that we have a city councilman here. Can you raise your hand? With us today, learning about menopause as well. You might need to know about it too. And so again, we thank you for coming, and we hope that you enjoy your time with us.
Good evening, everyone.
Good evening.
It's so good to see so many of you. My name is Rosetta Carter. I'm the Director of Community Health Education for the City of Chester. And one of our focuses is to make sure that we get quality information into our city so that people can be helped and also be safe. But anyway, I'm here for the welcome. On behalf of the Honorable Mayor Stefan and fellow councilmen, members, we have been sitting back there, Honorable Fred Green, as well as Dr. Christian Montley, I say welcome. Because of the health issues in the city of Chester, it's imperative that we have such health forums such as we have tonight. I say special thanks to each panelist. We need persons like yourself to share quality information in the underserved communities such as Chester. Again, I say thank you and welcome AKAs, and let's keep Chester safe and healthy. And God bless you all.
Next, we will have the welcome and introduction of Resource Row by the President of Tall Delta Omega Chapter, South Kappa Alpha Sorority Incorporated, Monica Washington.
Thank you, sweetheart. How you doing?
Hello, everybody. I am so excited that everyone's here. I was at a dinner party and I was speaking to a number of young ladies. Where are they? They're in the audience. There's Marty and there was Missy and I think Patrice is on the way. And we were at a dinner party and we were talking and the topic landed and stayed on menopause. How we get on our nerves, how we're going to get through this, and all of the things. And I said, with us in our sorority, we want to do things that are impactful. That is what our mission is to make sure that we provide supreme service. And so when I think of things that are supreme and service, things that are going to impact our community. And so I am so happy that all of you are here. I'm so happy to our panelists who have, graciously agreed to come. And so I want to also, while we're here, tell you about our resource room. These people up here are absolutely phenomenal. They're going to give you all the information that you need. But when you leave here, you're going to need some resources to help you through. And so I thought that it would be neat to have rows of people around the room that has the resources for you so that you will be able to, like this and be able to thrive as you change. And so we have over here our IPQ analytics. Dr. Liebman has wonderful information at that first table. He is a scientist, so all of the things that he may want to share with you, grab a leaflet, inform yourselves, because the best way to have power is knowledge, right? We then have our Pretty Booty Foundation, and again, one of our panelists, Sherelle Flagg. She is a menopause wonder in the state of Delaware. She has started a foundation around this area. You're going to hear a little bit more about her a little later, but she has all kinds of things. If anybody came in here and had a hot flash, she has cooling devices, she has patches, she has a little bit of everything. So you want to stop by her table to see what resources that she has. And then we have our All Facets Health and Wellness Center. This is a native of Chester who is a nurse practitioner, and she has a medical spa that is located in Delaware, where if you need help with your metabolism, if you feel like your energy is low, or maybe you need a little extra boost with your weight loss, she can talk to you about all of those things. And then Elite Fitness, we have our brand new personal trainer, Courtney, in the back. And we have Sonia, and Sonia is going to be heading an over 50 plus weight fitness class. So for those of you that said, oh, I see, Courtney and Akeem on Facebook and they kill people. Not Courtney, her husband Akeem. Courtney tries to help us out. So maybe you need something that's a little more low impact and all of those things. Sonia is going to help you with that. So if you are looking for something to get you moving, you want to see her. And then we turn over to the right, we have Miss Mary's Greenhouse. Miss Mary's Greenhouse has all the things that you need in terms of detox teas. She even has oils if you're experiencing hair loss and all of those things. So you want to stop past her table. She is very, very knowledgeable about nutrition and things of that nature. So you want to stop past there. If you look at her mother's transformation on the front, so Thea has helped her with that, so that is wonderful. And then as you know, as you change life, in the change of life, sometimes you want to change life, right? And so you're going to need a life coach to get you through that. And so You Belong Life Coaching Services, Ms. Michelle is here to talk to you about that if you need some help in that area. And then we have a table here, we're going to have Dr. Shirley, their questions. Because sometimes you may not need medical advice, you may not need fitness advice, you just need some practical sage advice, practical wisdom. And so we have someone who has already been through the perimenopause stage and may be able to help you with any practical questions. We were talking earlier about how, these men get on our nerves, and she's going to give you all that. So whatever questions that you have, you can talk to her over there. So that is all that we have. Oh, I'm sorry. The reason why we're here, the Bureau of Health has a table as well. So Alpha Kappa Alpha is not doing this by ourselves. We have collaborated with the City of Chester Health Department. And so the Bureau of Health has all types of things that you can take with you, information that you can share with your family. So please take the leaflets. We have representatives here. Ms. Rosetta Carter can talk to you. We also have Dr. Kristen Bolmaki that can also speak to you as well. So as we're ending this, we ask you to please go around and talk to each one of these resources because you have to live past tonight. We have to keep the momentum going. All right. And so, Councilman Fred, I don't know, did you want to say a few words? I didn't. Okay. Just want to make sure I'm doing protocol. All right. And so now we are going to have our Sisterly Relations Chair of Alpha Kappa Alpha Sorority Incorporated, Michelle Hill, and she's going to tell you about a project that we're doing in the city.
Good evening, everyone.
Good evening.
Welcome. I hope all of you feel welcome as you enter and as you're here getting your information in regards to menopause. I'm gonna derail us just a teeny tiny bit. The month of October is Breast Cancer Awareness Month. Now, some of you may have gone through the fight, some of you may be fighting with someone, some of you may know someone who actually did not make it through the fight. The ladies of Tall Delta and Mega, we pride ourselves on doing different things in the community. And what we're doing now is we're actually doing what we call our random acts of sisterliness. So when some of you came in today, I gave you a card, and the card had a pin attached to it. What we would like for you to do is to take a few moments and just write some words of encouragement in that card. What we're going to do, we have cards, we did this in our chapter meeting as well, but we have those cards, and what we're going to do is we're going to take them to a breast cancer treatment center. And we're going to ask those people to give those cards out. When somebody comes in and they may be having a bad day, they're going to get a random act of kindness from someone. When someone comes in and they're fighting alone that day, they're going to get something because nobody fights alone. So our random act of sisterliness, and it's our community service project for the month of October, we wanted to extend it out to you. So if we picked you and gave you a card with a pen, please take a few moments, fill out the card, put some words of encouragement in it. You can sign your name, you can sign just from someone who cares, you can fight from someone who's been through what you've been through. I'm not sure we just randomly picked you, but if you did receive a card, please help us with our community service project and do a random act of kindness for the month of October. If you have any questions, I'll be out at the end to collect your cards. And if you have someone that you know that might be blessed by a random act of kindness, please provide me with their name. We're going to do some other things throughout the rest of the month. It will be giving out cards, maybe a basket, some other different things that we're doing. So please provide me with that person's name, or if you know of a treatment center that could use some of that information, please feel free to provide me with that as well. Any questions? All right, thank you so much. I'm going to hand you back to the reason why we've been here for menopause, because I know I'm waiting.
Yes, so I am super excited because I get to introduce our moderators and our panelists. They have some amazing bios, and I'm going to highlight some of the key accomplishments in each of their bios. Because if we read it all, we have time to talk about menopause because they all have such great accomplishments. So the first person I'm going to start with is our moderators to the right, Ms. Kristen Ball-Motley. Dr. Kristen Ball-Motley is walking in her purpose. She is a pharmacist and advocate for community health. Dr. Motley is praised for her efforts in advancing health equity. Hailing from Chester, PA, she holds a Doctor of Pharmacy from Florida A&M University and an MBA from the University of Sciences. She is smart lady. She is the founder of Health Educated Incorporated and host of the Keeping It 100 podcast. Dr. Motley dedicates herself to educating the marginalized communities on the importance of health topics. Recognized for her impactful work, she has received several accolades, including the President's Award from the NAACP, the Chester Branch accolades, including the Chester Branch accolades, excuse me. She also received the Humanitarian Award, the Health Literacy Champion Award, and the Innovative Pharmacist Award of the She is the Compliance Coordinator and Field Supervisor of Philadelphia College of Pharmacy at St. Joe's University. She is also the Health Manager at the Borough of Health for the City of Chester. Can you help me welcome Dr. Motley? Next, we have my lovely soror Kenya Lindsay. Kenya Lindsay is an experienced certified registered nurse practitioner who takes pride in providing the best health care possible for her patients. She is a native of Chester, Pennsylvania, and her early education was provided through the Chester Upland School District. She is a proud member of Kappa Alpha Sorority Incorporated, initiated and incorporated from Epsilon Kappa chapter, in April of 2002 from Coppin State University. After earning her bachelor's degree, she entered the business sector as a registered nurse. The core foundation of her nursing career has been emergency medicine, trauma care, in which she worked in the area for over a decade. After years of being a registered nurse, Kenya decided to return to school to obtain her master's degree. Kenya is a member of the American Nurses Association and the Gerontological Advanced Practice of Nurses Association. Kenya currently serves as a primary care provider at an internal medicine practice. She cares for patients within the age range of 18 years to the elderly population. As a nurse practitioner, her goals are to build a rapport with her patients, be relatable, and provide safe and therapeutic care with each encounter. Kenya is also an adjunct professor at Newman University, teaching an advanced health assessment course every summer for nurse practitioners. Kenya's favorite scripture is Proverbs 3, 5 and 6, which states, "Trust in the Lord with all thy heart, and lean not on thy own understanding. In all our ways acknowledge him, and he shall direct our path." Can you help me welcome? Dr. Even's bio here. This is a good bio. This is a good bio, but he got a lot going on here. I want to be like him when I grow up. He is the managing director of IPQ Analytics LLC and Strategic Medicine Incorporated. After serving as the executive director of Lindbergh Research Institute, now Chan Sung Chun Institute for Molecular Medicine from 2003 to 2007. He is an adjunct professor of pharmacology and physiology at Drexel University. He serves on the advisory board for the International Park for the Translational Biomedicine and the Center of Biomedical and Health Research and Data. University of Massachusetts. Y'all see what I'm saying? His research focuses on models of the disease progression that stress risk management, risk detection, disease process, clinical pathways modeling, disease stratification from life clinical perspectives. He utilizes system-based approaches and design thinking to represent and analyze risk-benefit analysis in pharmaceutical development and healthcare and reimbursement. Current application areas include multiple sclerosis, heart failure, triple-negative breast cancer, hypertension, hypertensive disorder for pregnancy, infant maternal morbidity, mortality, perimenopause, menopause, and the transition with an emphasis on underserved populations and health disparity. Y'all really got to welcome. Next up, we have another amazing soror here, Dr. Angela Davis Brown. Dr. Brown joins us from Total Care Physicians, where she served as an attending physician. She has lived in Delaware for 20 years and practiced in our state for 9 years. She also taught at the St. Francis Family Practice Residency for many years. Dr. Brown received her undergraduate degree from the University of Virginia. She obtained her medical degree from Temple University School of Medicine. She is a board certified in family medicine. She is interested in preventive care and assisting underserved communities. She enjoys the culinary arts, traveling, and fitness during her personal time. Can you help me welcome Dr. Brown? Cheryl Flagg is another one with a husky resume too. She was born and raised in Newark, Philadelphia, and now resides in Newark, Delaware. She is the wife, the mother, the mentor of a licensed instructor hairstylist. She is the co-owner of Le Dinner en Blanc in Wilmington. That's big. Rush Hair Products, Rush Salon and Spa, as well as the owner and founder of Pretty Moody and the Pretty Moody Foundation, a menopause lifestyle and wellness community, and now a certified menopause and health and wellness coach. Sherelle offers her services, love, and expertise to empower women and the youth in our community, and has a soft spot, especially for young girls dealing with adversities. She is passionate about helping others and making people feel beautiful from the inside out. She has spent over 2 decades working in the community with girls, women, business leaders, and anyone that she can help or impact. She stands as a beacon of innovation and compassion in the realm of women's health and wellness. As the founder of Pretty Mood Foundation, she has created a pioneering platform dedicated to supporting young girls on their journey to womanhood and assisting women in the phases of menopause. A visionary with a profound understanding of the unique challenges by women at different stages of their lives, her journey began with a personal commitment to make a tangible difference, and she was abruptly thrown into menopause by way of surgery during the COVID-19 pandemic. Recognizing the lack of resources and community support for women navigating their complexities in menopause, as well as the need for early education for young girls about their bodies and health, she set out to fill the gap. Her unwavering dedication to women's health, coupled with her innovative approach to community building, has garnered recognition and support from individuals and organizations across the health and wellness sector. A sought-after speaker and advocate, Sherelle's voice resonates not just with her community, but also in broader discussions about women's health, rights, and empowerment. Her work represents a deep-seated belief in the power of education, community, and self-care to transform lives. Can you help me welcome? So now the point that we all have been waiting for, I am going to hand the mic to our moderators, and we hope that you enjoy this time.
All right, so we're going to start our first question to all of the panelists, but I want everyone to know if there is a question that you have in the midst of the discussion with the panelists, please feel free to raise your hand so that we can answer the question at that time. We will have an area at the end for audience questions, but if it's a burning question and you just have to get it out, just raise your hand and we'll make sure we'll get the mic to you so you can have that open dialogue. So for our first question to the panelists, and this can be answered by anyone, we want to ask, what is menopause? And what's the difference between perimenopause and menopause? Is there a difference? We can start with Sherelle.
Hello. Thanks for having us this evening. Thank you to the AKA, the City of Chester, the Health Department. It's a pleasure to be here. Menopause is actually the point in a woman's life where she has gone 12 months without her menstrual cycle. Has to be 12 months. If you go 366 days, you have to start all over again. You are no longer in menopause. And the difference between perimenopause and menopause. Perimenopause is the period that starts, a lot of women, I don't want to admit this, but in our 30s is when perimenopause starts coming in. And it can last anywhere from 7 to 10 years until we get into the menopause phase.
I would also like to thank the organizers for inviting me. You see, I have my notebook out because while we're doing research, we're interested in doing research that actually means something to the patients. And so I have my notebook out because I take notes about the questions that you ask as well. The only thing I would really add is perimenopause and menopause are natural transitions of development. They're not conditions, they're not diseases, they're not anything like that. What we're doing in our research is trying to understand how early some of these events that are going to be naturally occurring might be affected by behaviors or things that could start even in puberty or during pregnancy, because nothing happens overnight. Sherelle gave you the definition of not having a period for a year, but perimenopause itself could be 7 to 10 years long. And we don't yet understand that transition. And one of the reasons we don't is because we don't have the data. And so what we're involved in, and we can talk later about in more detail, is figuring out what's the right data that we need to help women know much earlier where they're headed, what to expect, what's normal and what's abnormal, so that you have better guidance and better confidence in what you're experiencing, and know when you need to see a specialist, when you need to see a physician, and also to better communicate what's going on with your physician. So you're working together with your physician to come up with the best treatments and ways to deal with that in a guided manner.
Enough said. I find that that's very,
question since you have the mic. Physiologically, what is happening to me? What is happening with my estrogen? What the heck is happening? I need to like sear that in my brain so that I can know what's going on.
Well, I will say, can you hear me?
Yeah.
I'm going through it too. Thank you guys, of course, for having me. What I left out, let me just say what I left out. I didn't add extra stuff to my bio, but I trained at Chester, at Cruiser Chester. And I'm a heart protector. It was in the 90s, but I, even coming here, was like, oh, that was my tissue factory. Oh, that's where I got my hair that last. So, love Chester. Is it on? Can you hear me? I'll get you turn mine on. Better?
Yeah.
Sorry about that. Okay, so in any case, Ms. Monica.
Yes, or yes. Patient.
You're drying up. I'm drying up. You're drying up. Our estrogen is leaving. And what I learned as a patient, embarrassingly enough, when I went to the eye doctor, like, what's going on? I'm going fine. No, ma'am, you're in menopause. And your eyes dry up, right? My knee hurts for no reason. My whole knee. All of a sudden, I wake up and it's like, what the heck? Oh, my joints are also affected by menopause because they too are drying up. What the heck? All this over an apple? But I learned, just that one moment. Let's just do that one moment. What I learned from Dr. Lehman is it's not a disease, right? We medicalize it. We're westernized. We're indoctrinated to think, oh, I need a pill for this, I need a shot for that. Oh, there must be something. When actually, right, every woman on this planet goes through the same thing. And how do they handle it, right? Not everybody has the luxuries that we have or all the chemicals that we have in each hormone to get it started, right? But there's a lot that goes into it. And the other thing I learned from Dr. Lehman is that every single woman's hormonal life is different and starts in utero, right? Your mother's pregnancy determines your hormonal life because her hormonal status affected you as a fetus, affected your period of right. Mind blowing. Think of that. And then you go through pre-puberty, right? You're just straight up and down my boy. Then you go through puberty. Things change, your hormones start. Every girl's puberty is different. You're getting younger and younger with it, all kind of reasons. And then you go through childbearing years. Each pregnancy then determines your hormonal life in the future, because every pregnancy has a different blend of hormones and balance and all these things. And then you go through perimenopause. After you're supposed to raise these kids, work full time, right? You lose it. And then we spend the majority of our years in the peri and postmenopausal years. Pre-puberty is this long, right? Puberty is that long. We had kids, well, some of us less than others, right? But whatever span of years we had kids in, and then we spend this whole chapter of our lives that's never been looked at, never been studied, and no one gives us any clue about it. Because at least my parents were you're going to we talk about those kind of things, or they put some hands over like, we don't know. So we're learning, and our children will know so much more and benefit from what we give them, but right now.
Yeah, just to emphasize what you were just saying about everyone going through it individually. One of the challenges that you have is it's not well taught in medical school because it's not well understood, because it's not well studied. So that's the limitation. And what you will normally tend to do, which is natural, is to ask your friends and have a network of them, or look on the internet and find information. And what you have to understand is, when you do that, you're probably asking your colleague and friends about specific symptoms. So you may be asking them, did you have hot flashes? And what did you do about your hot flashes? But what you have to understand is, it's a process. And so someone else's hot flashes may be on a different path than your own. And their response and what they responded to or how they managed it may be different. So one of the things we're emphasizing and what we're studying is not just what are all the symptoms you have, But when did they occur? In what order did they occur? And which ones occur together? Because they will help define your path. And what you need to know is, well, your path may be different from someone else's path. And that also then converts to postmenopausal disease risk, because your risk for different diseases, breast cancer, osteoporosis, cardiovascular disease, will be unique to you. It's not just a population approach anymore. It really has to be personalized.
We have a question over here. You might turn that mic off, Dr. Brown.
Thank you.
I need to know when they occurred and the other two things they have. Because somebody write that down. The three things you're supposed to write down, when did it occur?
And they couple with like what
Yeah. We got that. My question is, Dr. Goldberg, you said that, it's hormonal and it's generational, like what your mother went through. And the question I have, is related to like fibroids, they have a whole different experience. And so, that's fibroids and perimenopause.
In a second, I'm gonna hand the mic to Cheryl, but I will say, because she's living through that and can answer that, I would say that I was at a training last year after 26 years of practice and thinking I knew a whole bunch of stuff. And they asked us what the most popular surgery in America is. And we were all like, oh, appendectomy, tonsillectomy, hysterectomy.
Wow.
And then they showed a map of America, and where the most hysterectomies are done, red states. Red states. So, all that to say, the other thing to know, and we do get thyroid more, and this is all part of our hormonal makeup, there are other procedures that aren't even taught to physicians all the time. For fibroids, there's something called uterine artery embolization, where they need to go in and do that, they get further, like there's lots of other options for taking out your uterus, because it's no longer worth it for society. I was named after Angela Davis.
So you'll see how long this answer is going on, from this, what is this menopause dating for me?
Yeah.
So I just want to touch on a couple of things. As Dr. Lehman was saying, we all have our own unique menopause journey. Yes, we might experience some of the same symptoms, but they're going to impact us all differently. So I always try to say, our own toolbox for menopause, because what might work for me at a given time might not work for you at a given time. This is why it's important for us to pay attention, like what we're going through, and not ignore the symptoms and the feelings and the emotions and all the things. But as far as the surgical menopause goes, I got thrown into menopause by way of surgery during the pandemic. And at that time, it was a very abrupt decision that was made. My doctor was like, you have to have this surgery now. Number one, it was COVID, so I was not trying to go into anybody's hospital. I kept trying to put it off. I'm like, okay, our business was shut down for 3 months. We had literally just opened back up. We might have been open for like a week or so. And she said, no, you got 2 weeks. And I was like, what? So at that time, I started asking other women around me. I'm like, okay, I see y'all, I do hair, I've been doing hair 30 years now, y'all sweating in my chair, we want to talk ladies. This is about to change. Nobody wanted to talk. Like nobody, they didn't want to acknowledge that. I mean, they were literally dripping sweat. No, I'm like, this. But like it was such a negative stigma, and it still is, hence the reason why we are doing what we're doing. Surrounding menopause. So I just wanted to have healthy conversations about it. I couldn't find nobody to talk about this. Again, 2 weeks. Okay, I'm trying to prepare for a surgery, trying to get information. So I went to Dr. because I couldn't really get the answers that I was looking for from the physician or from anybody else. What I said the other day was, if I had known what I know now, I wouldn't have had, I had a partial hysterectomy back in, oh gosh, I was 27 then, I'm 51 now. I wouldn't have had that then, because it came from like fibroids, cysts, things like that. But because the doctors are not, some of them are not educated enough in those areas, the first thing that they want to do is say, let's just take it all out. Right? So this is why it's important for us to show up at these community events, do our research, right? Speak to the other women in the community, talk to our doctors. We have wonderful doctors that are learning, what this really means for us. And they are admitting, right, that I wasn't taught this, right? And we need the truth. We need to be able to go in and say, hey, you know what, this is what's going on. I need to be able to talk to you, and I need you to be able to talk to me. But if the doctors don't have the information to give you about it, they're going to give you what they have. And it was, you have to have a hysterectomy. So going back to, I'm going to make this long story short because it's very long. Going back to 2020, I had to have the ovarectomy. I had one ovary left, and it was really bad, and it had to come out. But again, I didn't know what that meant for me. Surgical menopause is completely different from just transitioning, naturally into menopause. You don't know what symptoms you're going to get. It's over, I think, 100 symptoms now. I got about 250. And every day a new one is knocking on the door, right? So it's a lot to wrap your head around. And I think that's why a lot of us don't even want to address it, because it's so much that comes with it. But education is power, and we have to be able to understand what is going on with our body, because every single woman is going to go through menopause. There is not a woman on earth that this is going to skip over. So we got to advocate for ourselves, ask those questions, and if you're not comfortable when you sit in the doctor's office, go find somebody else. You do not have to settle for them telling you have to have it. Right? Those symptoms, when you have surgical menopause, you get pretty much everything thrown at you all at once, because your body does not know how to process what just happened. Naturally, it's a progression. We're going through, our menarche stage. We go through the premenopause, which is what we're still having our, periods and everything. Then we hit in the perimenopause, menopause. Like, your body is already set up naturally to do those things. But when that's snatched away from you, it's like, okay, what's going on? I had a nurse explain it to me the best way. She said, again, naturally your body is prepared. When you are going through surgical menopause, it's like, just imagine all of the menopause symptoms just all spinning around, and they just trying to figure out where I'm going to land. And that's what you got to deal with.
Before you ask them, just something you just said, symptoms. Because I was talking to some people in the room, and they were saying, "Oh, I didn't go through menopause." What are some of the symptoms? Because I think people feel like if I don't have hot flashes or night sweats, that's perimenopause. But what are the other things that would be considered menopausal symptoms?
Thank you for that question. That's a great question. And a lot of women think because they don't have the more obvious symptoms, like the hot flashes, the mood swings, things like that, they think that, oh, it didn't hit me. But there are, again, over 100 symptoms. Something as simple as someone called me the other day and said, I'm having an ear ringing, tendinitis, like it's a menopause symptom. The joint pain, you were just talking about that. Insomnia, cold sweat, the night sweat. Burning mouth syndrome, toenail fungus, eye problems. We talked about the dry eye earlier. So it's so many things that happen to us in menopause, but often they can be misdiagnosed because they mimic other diseases. So we have to be careful too, and that's why we need to have those conversations, with our healthcare providers, because we can be blowing something off and thinking that, no, it's the same, and it can be a miracle.
I'm sorry, 1 second. We just have another question here that's still waiting, and then we'll come down.
Let me just add to that, because we touched on it briefly. There are a lot of things that are going to happen to you naturally over the course of your life. You are the best person to understand and recognize what you've gone through. A physician right now has about 15 minutes to collect information, and they're looking at what is the thing that needs to be done today, and they don't have your history. Now, Sherelle talked about surgical menopause, surgically derived menopause. Development in general has to be understood because this is a natural process. One of the things we're looking at, to give you an idea of the potential, not telling you that this is something we know is important. If you deliver prematurely, just as your body is set up to go through normal development, you've interrupted a pregnancy and normal development. The mother, which is supposed to be somewhere around 38 weeks. The mother has not received all the hormones from the fetus, nor produced all the hormones that she would in a full-term pregnancy. That's the kind of thing we're starting to look at to see if it may be involved in producing early or different menopause and changing the way women progress. So it's to your advantage to start now recording some of the information that you've gone through and bring it to the doctor when you go there. They may not know what to do with it right now, but you're going to be the one who can document it. And what we're trying to do with research is figure out which of those things are going to be most critical and how to incorporate them and how to tell the doctors what data they should be asking for, because it may be relevant, even though they may not even think about it right now.
Good evening, everyone.
Good evening.
So during menopause, you're like getting irregular periods. So are you still fertile, or is it like having a period on birth control when you're just menstruating? Yeah. Yeah. Yes, all the above. If you still get pregnant, you're still menstruating until that 364 days you get pregnant. Like, and the other thing I want to say, and everything is positive about that, and the fact that everyone was so shocked, well, dang, then I'm in menopause. It's the truth, and to detach the stigma from that. Like the option, we were just talking about this beforehand, the option of not going through menopause is going to your coffin early. If you're alive, you're in menopause. You have that period over here. Period. It's a phase of life. It's your hormonal phase of life is that you're in menopause. My hormonal phase of life is I have gray hair. And I can cover it, but I still have it.
Okay.
Same thing with that.
We have several other questions. We're going to go to Ms. West.
Hello, everybody. Monica kind of touched on something I was going to say. I'm 81 years old, and as far as I know, I've never been through menopause. The reason I thought I've never been through menopause is because the common was flash. I would have. Now, I did mention something about it, and I had partial hysterectomy, and it was said that if you have a partial hysterectomy, you won't have to go through menopause. I don't know if that's true. One of the things that came up in some of the conversation was arthritis, and I have a whole bunch of that in my body all over. So maybe that's my menopause thing. I always thought I never went through menopause, but maybe that's the arthritis that maybe arthritis is what menopause is.
I'll just mention, because it's another area we work in. We work in multiple sclerosis. And when you look at multiple sclerosis, it has a significant overlap with perimenopause. And if you look at some of the symptoms of perimenopause, they overlap with, again, symptoms of multiple sclerosis. And so you get confounding symptoms and confounding demographics, which make it difficult to determine what is causing some of the symptoms that you're presenting at different points.
And also, let me add to what I was saying about the estrogen and you dry up. I was being facetious, however, it's quite true. So menopause is the lubricant, estrogen is the lubricant. So right now, my mouth is dry, right? I feel like I have this crappy lips because I have lip gloss. That's the estrogen. And it's in every system in your body, your neurologic system, your muscles, your joints, any membrane you have is going to be a little drier. Right, and how it might show up neurologically is you can't think of a word. That could be a menopause.
Wow, that brain fog must get people there.
But I just wanted to touch, and yes, you did go through menopause. But we also stay in postmenopause until we die. We do not enter postmenopause and leave. Some people think, oh, I'm going to postmenopause, and because the symptoms kind of taper off, or you may not experience any more when you're in postmenopause, but you're still in postmenopause. Postmenopause is also a stage where symptoms can reoccur in elderly women. It happened to my mother, it happened to my mother-in-law, her hot flashes, both of their hot flashes came back. Someone else I know, she's 77, she started mimicking the same symptoms now that she did in her 40s. So we leave here in postmenopause.
And then the last thing on that was what Dr. Rita alluded to earlier, when we have these changes, when you have coronary arteries that don't have as much good cholesterol or acidic glucosa, your risk for heart attack and stroke and all that go up, and that's part of postmenopause. It is not getting into the cancer or whatever. It affects your body, the rest of
But one of the things that I talked to the doctor about was my eyes are constantly white. And I think there are these 4 stores who walked up to me and see me, like, you okay? Because this is my eyes. So I asked the doctor, he said, oh, it's just dry. I don't know. He didn't say anything more, he said it drops. So when I used to say, dry, to the situation. But you just mentioned post-menopause. And then you said you die. So my question really no, we ultimately think that the journey, and I'm moving the journey with angry. But apparently what you're saying is, it doesn't. You're just gonna have symptoms of some form, which you may or may not know are symptoms. So is that the way it works?
Well,
It doesn't.
the thing is, right, we're all in these bodies, and when I tell my patients, your body, imagine a car, right? When you get the car, it's brand new, it's shiny, nothing's wrong, nothing breaks, lasts a long time, like a kid. But then, you might get a punctured plank there, you might get a rust spot here, right? You might need a new paint job, you might need a new, but you don't, the engine's still going, right? As long as you keep the engine on, replace the parts, take care of it, it'll last a good long time. This hillbilly man I married, he just now put his minivan to rest. 89, 90, whatever it was, 360,000 miles. I was like, but he loved that car and he kept up the parts enough. Same thing with us, right? Like, I don't know, are your eyes gonna get better, or they're not gonna get better? Only time will tell. But you'll do all the things to take care of your children, right? I don't know, are your knees gonna always hurt? I mean, they're never going back to what they were when they were 20. But they'll be livable and understanding your body. And to his point about the 15 minutes, you live with it. Right, I don't get you for 15 minutes. I better listen. I better make eye contact, understand what you're saying, and I better not have a big enough ego that I think I can just tell you. Right, I can tell you what I know, what you studied, but I've never lived in your body. Nobody has.
There's another point to consider. We tend to use labels. So saying that we're postmenopausal just means it's a period of time. You're also post-puberty. You're still post-puberty.
I have a question. First of all, I'd like to say thank you to the three of you for having this important forum with us today and so open, because for many years, people don't want to talk about menopause. But I have a question. Now, is there a difference between African American women going through menopause, just like Caucasian or any other nationality? Is there a difference? Because you're talking about it can lead to cardiovascular diseases, strokes, and all that. And in African American communities or around, you'll find that those type of diseases are prevalent. And lastly, I want to ask whether or not is there data? Thank you.
I just love how you guys are asking like all of our questions, right? Questions that we have written down, and you guys are just putting them out there, so we love it.
I'll start with the last point. We don't have the data we need. So we are generating a survey that will be open to the public to collect the data that we need to answer some of the questions you're asking. So among the things that you raised, there are differences in different population groups. We work with a number of underserved populations, including the Black population. We work with the Native American population. We work in Australia with an indigenous population. And they all have different characteristics. But some of those characteristics we know start much earlier, not just when you think about going through perimenopause and menopause. So an example would be, one of the things we're looking at is age of menarche, which is decreasing. Age of first pregnancy, which is increasing. Number of pregnancies, BMI at time of menarche. Because the two periods in development we have the greatest hormonal change, at least from a modeling perspective, are menarche and pregnancy. And those are the periods then that have the potential to have the greatest your hormonal transition, which was and menopause. BMI may be, because at menarche, BMI may be important because certain hormones are fat soluble. And if they're fat soluble, they may be stored. To show you how complex this may be, there's a lot of interest in GLP-1 inhibitors. for obesity.
Can you explain what GLP-1 inhibitors are for the
What
audience?
Please.
Is that bad?
So all the drugs that have become really expensive, and that are very trendy.
But I know the data is important, and sometimes in African American communities, they don't like to be a part of research. So
You're right.
what are you doing trying to encourage them to be a part of research? Because again, that's how we're gonna find out what's working and not working.
And that's part of inclusion in the studies. But what I was going to raise about the GLP-1, again, we don't know because we haven't had them out long enough. If you're reducing fat, and fat has been storing hormones, then those hormones are suddenly going to be produced out of the fat because you no longer have the fat to store the hormones. We don't know if that's going to produce long-term effects because we don't have the data, we don't have the experience. So medicine is still an experiment, and we're doing the best we can, but it's still an experiment.
We call it the practice of medicine. The art of medicine. Let me add, Dr. Gleason said the BMI of energy and all this. How many of us have noticed that the BMIs of our children are way higher than what they were, right? The ingredients in food are way different than they were. And I tell my patients, even with blood pressure, the blood pressure studies that were done initially were done in the 1950s when only white men were studied. And the average white man was 5'6" and 140 pounds. I can squash you, and I'm petite. But this is where all this data comes from, and we're not included. So kudos to Dr. Gleason for including us, being interested in us, and studying us. And this study is going to help us knowledge-wise, but it's really going to help our daughters and granddaughters.
I don't have much to add, but you asked what we were doing about it. Just having events like this where we can impact our communities and get the information out so that we can stay connected when a certain thing can be a part.
We have a question here.
I wanted to circle back to what Dr. Brown said about your hormones being given to you in utero from your parent, from your mom. How does geriatric pregnancy affect how much hormones you receive and how you go through menopause?
Great question.
Versus what we would consider like a teen pregnancy. Because when I think about it, I'm thinking, okay, the younger you are, the more hormones that you have, so you pass more on to your fetus. The older that you are, you have less hormones. We're talking about G1LP, right? So how would that affect you, the fetus, as it grows older and it matures with the level of hormones?
That's a good question.
The question is actually a little bit more, the answer is a little bit more complex. And the reason it's more complex is during pregnancy, the fetus produces about 1,000-fold excess of estrogen over what the mother produces. And so the fetus is producing estrogen at a level that the mother normally would not be exposed to. And so one of the one of the questions we're trying to look at is if a pregnancy is later in life, what you're calling geriatric, does it start to overlap with the start of menopause, when your system is down-regulating estrogen, but the fetus is overproducing estrogen. Yeah, so does the production of estrogen from the fetus go against what your body is doing if your pregnancy is overlapping your start of perimenopause? Because your body is reducing its response to estrogen and the fetus is overproducing it. And that's one of the things we're trying to study because we don't have data.
Good evening. My question is forms of birth control. So say, for example, I was just talking to a friend and she had been using an IUD. She's over 50, and during that time, she wasn't having a period and still not having a period. And her doctor recommended to her to continue to use the IUD until she was 60. And I just thought that was a little odd, knowing that her body hasn't even been through menopause yet.
We'll say, well, this was during not a gynecologist. Also, gynecologists are surgeons. And their training is there. And a lot of gynecologists, even my gynecologist, doesn't always take the holistic person. Sometimes they do and sometimes they don't, right? But they might be looking at the data, the study, and the right answer. And again, there's not a right answer for you or you or you or you or you. Like, everybody's different. So would I choose to have an IUD as a 50-year-old woman? But again, the more I unlearn what I was taught in medical school, because we were taught, like I was taught that a hysterectomy was the gold standard, right? And I'm not trying to point out the obvious, but I'm black. I had to study, right? There was no nepotism, there was no grant, there was no trust, right? I had to get the A's on the test, I had to get them, and I have to do the gold standard, so I did what I was taught, only to find out 2 decades later that was not correct. And it's the same thing with nutrition and what I learned. And so it's not that they're wrong, because there might be a study or something that says that, but is that what's going to work for this woman for the rest of her life? And you've heard of it. My goal is always the same for everyone, and it should be the same for each of you. Right? We live as long as we can, as healthy as we can, in our right mind, sort of, and not being kind of.
There's one piece of advice, I'm not a clinician, but it's a piece of advice I give to my sister, her friends, and my friends. And that is, as Dr. Brown mentioned, and I mentioned, you normally only have about 15 minutes with a physician.
That's true.
When you go in there, you're nervous because you're seeing a doctor and you have a problem and you want to try to get that out. What I tell everyone is, a week before you go into that office visit, write down everything that you can think of that's going on. Because if you go to the gynecologist once a year, you can't tell them your entire year's history, nor do they know how to deal with that or what questions specifically they ask. They're looking for very critical things, not chronic things. And those chronic things may be incredibly important for getting you the best care that you can achieve. And you're the only one who's going to be able to put that together, put it in writing, make 2 copies, leave one with them. And they can put that into your record and have that as a reference. And you'll, given that information, it'll be very valuable, but they won't be able to get in that short time.
Really good. And I wanted to speak to, you were saying that she has not gone through menopause because she's definitely still want to go through all her phases. Even if if we stay on birth control or whatever, it's not going to stop, what's naturally going to happen with menopause. The other thing I want to say is, speaking to that toolbox again, Dr. Lehman, that was amazing about having, writing it down, having your notes. I keep so many notes in my phone, I don't remember nothing, okay? So I got notebooks, notes in the phone, but it's really, really, really important that you are showing up to your doctor's appointment with some questions, with your concerns. Like, pull out all your notes if you have to, because like Dr. Lehman just mentioned, your GYN appointment is usually once a year. We already don't remember anything, right? So going in there trying to, you're not going to remember when you get in there. So make sure that you have everything written down and don't skip anything, give it all to them.
Also, on that, you made a really good point, 3 years, right? They changed it because of technology has changed. Passengers aren't looking for abnormal cells anymore, they can detect the actual HPV virus. So oftentimes, they will put you off for 3 to 5 years. So, the key with the list, and I love a list, I want to think about it, love a list. Bring me the list, because then I can look at it and prioritize, I can look at your top 3 things, oh, your acid drive, meter, here, and you're, okay, that's menopause. This, and then when you get to, because doctors have an agenda too, right? And we already know what we want to get from you, and then we need you to walk out the door with what those things are, and I always in the business go. If you weren't so tired and you can remember something, you're like, we working, right? Good, and we're on the same page, right? And you want to get whatever it is that you need the most, get that, because some of them will cut you off. Other than my residency at Grocer, that the average physician will interrupt you after 11 seconds. So they taught us how to sit down and listen to somebody talk until they stop talking. And when somebody feels seen or heard, it's not wrong. Unless they have some kind of mental disease where they just can't stop. But for most people, you can get it out in a minute, minute and a half, 2 minutes. Like, it's not forever like people think.
Thank you so much for the invaluable information that you've given this evening. I have a question about hormone replacement therapy. Many Black women are not offered this, and we know between the follicular and the luteal stage of our menstrual cycle that we have a surge of estrogen and progesterone. And what is the thinking postmenopausal or perimenopausal on the use of progesterone? And we were taught years ago, no uterus, no progesterone. But a lot of integrative medicine is starting to say progesterone. So, too, and combinations. What is your thinking? So, Black women would know what would be best available to them. Best benefit.
Again, that's part of the unlearning, right? So there was a study that I was taught under the WHO, whatever that was, right? You were in it? Okay, thank you for your service. What we were taught was, don't do hormones, do get cancer.
Yes.
Right? Pretty much, don't do hormones. And then we learned that actually that wasn't a great study, nor was it all true. So progesterone actually can help in some of the symptomatology down the road. My gynecologist did offer that to me. And again, if your system's going through what your body expects, adding something new to it isn't always the answer either. You can kind of try samples, right? You try before you buy, and I tried it, and I'm like, no, I'll just take one regular outside and do some pretty weak patches thing. But whatever your body goes through and however it responds, absolutely. And it's not as dangerous as we thought before, and we're being taught not to try that more. And then you have more integrated physicians who are doing what they call bioidentical hormones, where they test where your levels are, and then make a compound that best suits you. And I think it's an amazing idea. Again, hormonally, there's this gray area between medicalizing and turning this into a disease and learning to live with the bodies that we have. But for the future of medicine, I think that kind of integrative and matching and unique individual needs are the way to go. And even with the old Western stuff that we do have, what's the best combination, and how can we incorporate oils and, natural things into what we're already doing, the way thousands and thousands and thousands of years of women have.
You have a question over here?
Good evening, everyone. So I'm 43. I'm in perimenopause. I think I've been in it since I was like 30 or 31. I also have adenomyosis. And every month I feel like I'm in a fight with I'm gonna use Jackie Frazier and Layla Ali. And I've noticed also palpitations come with it and anxiety. I know you just said something about oils and natural products, but do you have anything specifically that we can use? Because it's a fight.
Wait, I'm sorry, can you say what you're looking to address specifically again?
Yes, the fight. Because, Casey knows, like, my, adenomyosis with the perimenopause has been so bad, it's sent to the hospital. And I'm just like, what can I naturally take to help combat both the perimenopause and the adenomyosis rectum?
So this is where I speak to what I spoke to earlier about like having your menopause toolbox, right? Because there are things that you have to find that is going to work for you. Speaking to the hormone therapy, I feel like every woman has to do what's right for them, right, on their menopause journey. Because again, what might work for somebody else might not work for us. But there are you having like heavy menses still and things like that? So there's a couple of supplements that I can tell you about. We can speak afterwards, and I can give you like a list of them that can help with that. As far as the menopausal symptom, we have like natural patches, magnesium sprays, like topical things like that that we can talk about as well. There are a lot of, I mean, if you Google now, everybody is trying to come out with something for menopause naturally. So again, you want to be mindful of number one, the ingredients. You know, how is it going to affect you? Sometimes you don't know until you try it. Also, I am not a doctor. I have this amazing team of experts here for a reason. But you want to speak to your physician also to make sure that the things that you do decide to try are not going to adversely affect you as well.
And the other thing, and I appreciate, like, I had one too, and I asked my gynecologist, let's take it out. Brown one, let's take it out. But I get that frustration, and part of what she told me, my gynecologist is also my friend, and she knows me, and she said, girl, get your life together. Right, and at the time I was going through it, I was crying, I couldn't sleep, I was crying. And to her point, I was putting ingredients in my body, right, that weren't helping me in any way, shape, or form. And it's not just a uterus down here, it's my body, my arteries that are feeding it, right? What I put in determines how everything functions. Sugar, and I always use the analogy of the car, right? Would you say, you know what, I'm driving to California, let me put some sugar in my tank? Absolutely, right? We visited my kids, go look at a cow, and we had an argument at the gas station, and I wasn't premium gas. My husband was like, you're great. No, I wanted, right? Nothing bad can happen on this road. Like, I just want to set it up for success. Same thing with the rest of the vessel, right? That's just a piece of the vessel. And our ingredients in our country are loaded with hormones and inflammatory ingredients, and inflammation makes everything worse. Everything. I was telling many friends that I went to Ghana this summer, and it was a trip of a lifetime. It was amazing. And afterwards, I can show you guys the picture of my cousin Lizzie, 63 years old, right? When she got off the plane, and then 5 days later, she looks like a new woman. You won't believe it. Like, in America, that would have taken years, right? If you just use what we know, Weight Watchers, all these things, right? When it's the food, it's the food, it's the food, it's the food. And it's how we use our muscles. Your biggest organ is your muscles. If you're not using them right, they're not going to help you. And we talk about estrogen and progesterone and all FSH and LH and all these hormones. The truth is there's hundreds and hundreds. And we don't know the names of all of them. We don't know how they work. We don't know how to measure them, but we know that they work together. And that when we take one piece out of the machine, nothing will work right.
Good evening, everyone. So my question is, as a young girl, as we reach puberty, we're thoroughly prepared. We're constantly talked to, things like that. However, we understand why this event is so important because we usually don't have this conversation amongst ourselves. What would you say is 2 to 3 things that a woman can do to prepare for menopause if she hasn't reached it yet?
I would say the first thing, that's a great question. Thank you for that question. You're absolutely right. Back up a little bit. I have a strong interest in changing the way the sexual health education I'm not gonna say it's obsolete, but it's very outdated. And it stops there. Like, we don't go past really like go past some pregnancy, but it stops right there. So the education and the knowledge that we need to get from being a young girl, when we're being taught sexual education in school, this needs to be latched onto that and made a part of it, because again, this is a natural part of our lives. 50% of the world is in menopause, so y'all are outnumbered. Okay? I'm sorry, Dr. Lee. But one of the things that I would say is start paying attention to your body. That's key, because our bodies are really speaking to us. We're just ignoring it. Like, we like, oh no, I can't do that. I got too much stuff to do today. I ain't got time for that. Oh no, I can't do that. I gotta keep on moving because I gotta keep it moving. So we're not really paying attention to the progressions and changes that we are experiencing in our 20s, even 30s, right? Some of us in our 40s. So I would say, start paying attention to your body and start journaling about it, taking notes, like just writing it down so you can go back and you can see, hey, well, 6 months ago I was feeling like this, and now you will see anything that's different that's going to happen. The other thing I would say is talk openly to your doctors and your healthcare providers about how you're doing. Get what you need from your healthcare provider. Again, I said it earlier, if you're in your doctor's visit and you don't feel like you're getting what you want, find somebody else, wonderful like Dr. Brown, that will sit and give you all the time that you need until you feel comfortable and understood. Because that's really important.
I'm going to add really quick before I begin. And for those of us who are blessed to have older women in our families, ask them. Right? We're getting ready to have Thanksgiving, Christmas, all this stuff. Make a warm space that's okay for them to talk about it, knowing and respecting that this was that's not their wrong culture, but they're here and we can still ask. We have a conversation about all the questions we wish we had asked our grandmother. Right? So ask.
And just to reinforce what Cheryl said, Sasha, who isn't here tonight, COVID for the 5th time, maybe the 6th time. But when she started on this project, she said to me, I don't think I really had any exposure to menopause. She's in her 20s. It's not something that is brought up early to understand it's part of the natural development. And it needs to be incorporated into education.
And on that note, COVID is the other one that can trigger hormone changes, triggering pregnancy, periods, and everything, and we don't know. Same thing with these shots, and I'm not gonna be anti-or pro-vaccine. I don't trust anything anymore, but I get them. And if they give me what they give me, I saw some horrible things with COVID that I just can't ever unsee or go through. But they'll live that.
So I have the next question, that's my question. The whole like visceral fat that comes around your stomach, where is that coming from? Like, what is it's like, is it gonna go away after you get through your year? Like, it's cycle, like, what is this? It's like from the pit of hell. What is it?
It's the video, the new book, the new thing. But that lately I've been studying, one of the things I've been studying is actually breath and the vagus nerve and our visceral nervous system. And it came up organically at the gym. One of the trainers was like, hey, we're going to do this breath work for 2 minutes at the end of class. So I do the breath work with her, right? And she says, try this. First of all, they should feel amazing. Second of all, try this. We'll do 2 minutes and then we'll work out. Try it while you're working out and see what happens. So I tried it, working out, and I couldn't go. And I could run 30 seconds, jog slow 30 seconds. Suddenly I jogged for 8 straight minutes, right? Breathing.
And I listened to another lecture by this Harvard GI doctor who was talking about the abdomen, gas, bloating, visceral fat, all the things, fatty liver. And what she said was our problem is that we were never taught about our visceral nervous system, visceral muscles, as something we have to keep strong. We were taught about these muscles, right? But never ever. And one of the biggest muscles in there is your diaphragm. And all of us have out of shape diaphragms because we were never taught that it was something we had to exercise. And the diaphragm we were taught is the muscle that holds your chest apart, your heart muscle separate from all your abdominal organs. When that's out of shape, an out of shape muscle takes up way more room, right? An in shape muscle is tight and tense. So an out of shape diaphragm rides up, gives your heart and lungs this much room, and then gives your abdomen this much room. And your organs don't work right. And that alone is a risk factor for fatty liver, gas, bloating, abdominal issues, acid reflux, right? Everything, nothing's working right. Once you start to breathe correctly and work your diaphragm, it pushes everything down. And things work better, and in turn, it helps shape the six-pack a little better. And it's connected to your pelvic floor. And we all would like our pelvic floors in shape. Always jumping, sneezing situation. Yeah. So it's all connected, and it's all connected through the same nerve. So long story short, one of the things that can really help besides ingredients and processed food is breathing correctly. And I say I was 53 years old when I learned how to breathe. And how you breathe is the active focus. Okay, verse you have one hand on your belly, one hand on your chest. You want to push your belly out while you breathe in through the nose. Your chest should be in through the one hand on your chest, one on your belly. As you breathe in real deep and slow through your nose, you want to push your belly out, not move your chest. The belly moves in and out. So in and out. In deep through the nose, push the belly out. Out deep through the mouth, push the belly in. In deep through the nose, push your belly out. Out slow through your mouth. And the work is in the exhale. The work, and how many times do we not exhale? And the book is called Breath by James Nestor. And I didn't want to just be a doctor saying some trainer bro science stuff, right? So I listened to the book, and the science behind it is so real. And it dates back 4,000 years BC. All these meditations, it makes you exhale. I think I love thee, oh Lord. That's the same breath, right? Same singers know it, musicians know it. Okay. And when you exercise the diaphragm, you change your metabolism. You automatically lose weight. Your six-pack gets six-pack euros. Okay. So I like cookies and nutrition. But, it helps. It changes your metabolism, and it increases everything, including your lifespan. It decreases, it's been shown now for allergies, sleep apnea, fatty liver, diabetes, all these things that it can help. And Western medicine found out about it and then shunned it because it's not profitable, doesn't make the pharmaceutical industry. I think it helps sleep apnea. So there is a thing on Amazon called a breath exerciser, and if you've been hospitalized or go somewhere and you have this and they're $17 on Amazon. I do it less than I said I would when I bought it. But I still have it on my nightstand. And when I really feel like I need that breath, it also helps a lot with the insomnia and anxiety. Yeah, the book is called Breath by James Nestor. And when I bought it, I didn't think I would listen to a 7-hour book on breath, but it got so good. The first 5 hours was actually really, really good. And helps you understand the anatomy and the physiology of the system that we're just now learning how it works. And the other thing that we're learning is COVID has a huge impact on the vagus nerve.
right? And all this postural hypertension, heart rate, all the things, it's all vagus nerve mediated, and we've never learned how to work that nerve, so we're working.
So I have two questions, one from an anonymous person.
A friend of a friend.
The first question is, what do you think would be a good suggestion or a good idea to help and educate men around women going through the phase of menopause?
Get some upside your head with Catherine.
Oh, hi, babe. Let's give them Do you have any suggestions for the men? Come on, come on.
He should be used to it. When we're out, the ladies be coming up at him. Like, you need to talk to my husband. You need to talk to him.
My amazing husband.
Yeah.
We really don't, we really don't care. And I say this likely that sometimes when we don't understand things, we put it in like crazy talk. And that it helps us kind of figure it out. Or not figure it out, but just relieves us of the pressure of figuring it out. Yeah, but you just gotta tell your man to start researching. Because we can't fix it. That's one thing we can't do. So we don't want to get into the fact where we know more about something than you, because I don't want no suggestions on it. But we want to be more knowledge, make more understanding. Because when we talk about it, we just like, yo, I walked in, she wasn't howling, she wasn't like that. I give her a hug. What I did last week at work, the same for this week. So you gotta just kind of be flexible and understanding. I actually have a slide that I use when I give scientific presentations. And the slide says, menopause affects 51% of the world directly and 49% of the world indirectly. And that gets the message across.
So real quick, let me just say, it's also not fair here, right? So don't feel like crazy, this is not fair. In Europe, they have a menopause worker platform. You get FMLA. You can call out if you didn't sleep the night before. They have fans stable from water, right? And let's go way back to all these studies in medicine, and this has been about men the whole time. Hyster, right, hysterical. That's the root of that word, crazy. They used to institutionalize menopausal women. And then if they tried to use herbs and all that, they were wicked. So this is brand new, we're the pioneers, and we're killing it.
Yeah. I just want to say one last thing. I'm going to stand up for this. There is a male version of menopause.
Yes,
Yes. It's called andropause. Right? Andro is the Greek meaning of male and propause. It's a thing. And if you have Instagram, follow at Pretty Please because I drop so much information. I just posted about Andrew Paul because he was having one of his moments, and I just was like, it's not just us.
No, you're right.
We fighting at night, the hot flash, the fan, and all that. It's down to the mood swings. I know y'all see it.
Oh, yeah.
They might have went and bought a car, new lawnmower, or something. It's the same thing. So they're dealing with annual costs, we're dealing with menopause. But it's important, all seriousness, it's important that we do educate the men that we are connected to, our extensions, because they need to really understand what's going on with us. And they think that, a lot of them think that we can control it. We can't control this. He said, what he did last week might not work. No, what you did 5 minutes ago might not work the next 5. It's just, we just don't know where we're gonna be, what state we're going to be in. And we're not asking for that. We're not waking up like, oh yeah, give me all you got today, menopause. No, we don't know. So it's really important. I try to, educate him as much as I can about what's going on with me, because they don't know. And it is difficult. The divorce rate in menopause is higher than others. It's reasonable. I'm not, it's at all, but it is a reason for this, because people don't know how to make it through. It can get really tough on your relationship, right? So I'm definitely trying to do the work and educate the men and bringing them in and bringing them on board with this. They need to know.
So they could they realize it's like you'll have an episode that might be a big one or whatever, and it's like a week or a couple days will go by and then something else comes up.
Yeah.
Oh, you was good. Like,
Yeah,
no,
like,
I'm
I
good.
was good, and if I was good until you said that. Right. How about that? She called me up and she said, she was telling me about her ear ringing, and she said, I asked her how her husband was doing, and she said, I went to the store today, he wouldn't let me go by myself, and I said, why? She said, I just keep busting out when he cries. Like, I was crying. And she said, I was dancing in the car. And then the next minute, I'm like, I don't know what's going on. She said, I was trying to hide it from him, but he caught her a couple times. So now he's like, I don't know, I need to be there, with you. But it's really all about us just letting them know, like you said, it's up and down.
So, everyone, this is amazing. So, the questions that we developed, I'm being 100% truthful. We have 2 questions that Dr. Ball is going to go through. I don't know if you know, but we're virtual. We're live during this as well. So we have chat questions that people who are in the audience have. So we're going to close with those 2 questions. Dr. Kristen Ball is going to ask the panelists those questions. But our panelists will be here if you have additional questions, because I saw Sister Cheryl, I saw this young lady here had questions and had their hands up. But we're going to close with the last 2 questions. Then we'll have our closing remarks by our president. Okay?
Hey, I love a panel that I'm supposed to moderate that don't need moderation. One of the questions was on my mom, actually, I'm gonna call her later. So she'll be fine with her question. It was about medications and menopause. But one of the other questions was about mood swings. So what are your recommendations for helping ladies deal with the mood swings that they go through this stage in their life?
A lot of it is accepting who you are, giving yourself grace, and knowing you're not crazy, right? Are you working? Are you feeding a family? Did you clean the house? Like, you're doing it. And too much is expected, and it gets extremely overwhelming. So yeah, crying spells are gonna come, right? And just being okay with that. For a while, I had scared cry experience. It helped me out. Because at least then I would know I'll make myself sad, or I'll do something, I'll watch something, get it out. Otherwise, it comes out unexpectedly. I was crying the other night in your time with dating like that. And then they had not to show like the next episode, and I really did, but, you know, like, that's the thing. To say, oh my gosh, I have a crime, that's my problem, I never got it out. Exercise help, you know, all the natural things to help, and then when that's not enough, you're kind of depressive, like, fix what you can. I'm never against the Prozac, whatever it takes, right? I'm tender-headed, my hairdresser makes me take actual Johnson before I get my other one, you know, like me. So whatever it takes to learn you, and again, everybody's different, and the mood swings are, woo!
That's a good question. The mood swings they are one of the most common symptoms that we experience that just come about and we don't know when it's coming. So I like to say, try to tune into, is it something that may trigger your mood change? Because sometimes it can be, you might not even be paying attention to it. It can be something that you don't want to do. For instance, the laundry or something. You know, that might put you in the bad mood. And now you're a little off because you don't feel like that. But you're not really associating it with the laundry. You're not paying attention to that. So try to tune into, is it things going on that's happening when your moods are changing? I like to walk sometimes when I start feeling yucky. It's something about being out in the fresh air, getting that sunshine. I like to walk by the water. That kind of helps me. Try to find things to do. I love neroli oil because it's a natural, like, de-stressor, and it calms you down. And so I like to burn neroli oil or something to help stimulate, those good senses going. Just find little things that make you feel good when you feel like you're having those mood swings. They're going to come and they're not going to be like, hey girl, I'm about to trip on you right now. They just won't show up.
So we're really quick to close, and this was incredible. You all were incredible moderators this evening. To come to Chester, Pennsylvania to share your expert advice. We appreciate it. We couldn't touch on, a quarter of what we could have learned tonight. But where else can we go to find more information that we can trustworthy information to help us continue to learn about this topic?
I would say you can go to the Pretty Moody platform, prettymoody.com. You can find me on all your social media platforms. I'm not a doctor at all, I'm not a scientist at all, but I try to make sure that I am putting out information that is relatable to us, that we can understand, and that is going to help educate and empower us. So again, I'm on Instagram, TikTok, LinkedIn, Google me. But yes, the Pretty Moody platform is where you can find information.
I will point you to a couple of other sources that are sort of science and clinical. There's something called, it used to be called the North American Menopause Society. And it's all certified menopause practitioners. There are about 2,000 of them. And now it's called the Menopause Society, but it's sometimes under NAMS. The other place to look at NIH is the Office of Research in Women's Health, ORWH. They all have information about menopause that is readable in both English and in Spanish and several other languages, and it's information that's freely available. Another good source of information.
You can find the NAMS link on my website as well for the National Menopause.
Right, let's get a round of applause for our panelists and our moderators. I hope that everybody found this to be very informative. around the room. So this room will be open for a while, so please stop at each one of these tables. Maybe you need fitness, maybe you need some energy boosting or your metabolism, maybe you need a patch or some cooling device, maybe you need some hair ointment or detox tea, or maybe you need coaching for this change of life. So see all of them. Our research table for the Bureau of Health, or if you just need sage advice, practical advice, we're going to have someone in the corner who has kind of gone through some of these things. But I do want to thank our panelists. I do have a token of our appreciation. Sherelle, thank you so much for answering the call. Thank you for that. I saw Sherelle and all the work that she was doing, and I said this would be wonderful for the city of Chester. And so I do thank you. And then to my own doctor, Dr. Brown. She just has a very plain way of explaining things. And so that's why I love you so much, because of the way that you're able to explain things that we can just all get. And finally, Dr. Liebman. So first off, what is analytics? I don't even know what this is. I don't have a science brain, but thank you. Data does matter, and I'm glad that you are interested in what happens to us and trying to make sure that it helps us in our health journey. So just want to thank you. But thank you all for coming. We are going to continue to have programs for the city of Chester. Please, if you see anyone in the pink and green, tell them, give them your ideas of what we need here in the city of Chester. We have a think tank that's going to be happening in November so that we can plan for 2025. And we really want to impact the city. We don't want to just do programs just to do them. Tell us what you want. Tell us what you need, and we'll try to make it happen. Thank you again. Yes, so we're going to, if all our sorority sisters can come to the front at some point, we're going to take pictures, and then I do want to take pictures with the moderators.